Hey, everybody, welcome back to Practical Liberty. My name's Henry Bingaman, and I don't know if you've noticed it, but there might be something wrong with our healthcare system in the United States and globally right now. Um, it costs too much. The insurance companies deny most of the claims that they can. They try to screw you over every turn of the way. So, what can we do about this, right? We all need healthcare. Like something's going to go wrong in our lives where our health isn't going to be perfect and we're gonna need to see a doctor. So how can we pay for that affordably? Well, this week I have on the CEO of Crowdhealth, a company that I've used since 2021 for my own healthcare needs, and a company that I've recommended on this podcast many times. It is not insurance. It is a different way of paying for healthcare. And today I have the CEO, Andy Shoonover, on, and we're going to talk about this. So, welcome to the podcast. I want to ask you, the first question is really about the insurance industry overall, because you
Mhm.
founded Crowdhealth, which is this alternative. It's not insurance, it's a different thing. So, how did we get to this point? I guess is the first question. Like, why why is the insurance industry so messed up in the first place that we had to come up with alternatives to it?
Yeah, so it's interesting back in the 70s, which it feels like everything started running amok in the 1970s. We went off the gold standard and our monetary system went haywire. We started the HMO Act, which I think was 1973, there thereabouts, which basically, set in stone legislatively where we're at today in terms of health insurance. And I think ultimately what the problem here is that we have a principal agent issue. The health insurance plans are supposed to be our agent. They're supposed to go out and try to find us, really low cost, high quality services. But in fact, what they're actually incentivized to do is see prices rise and to reject claims. And there's a couple of reasons why. If you think about how the health insurance plans are compensated, there's all these premiums that go into a pool, claims come out of the pool, and then whatever's left is their profit. So if claims go down, then their profit goes up. So they actually have an incentive to reject claims. And in fact, with Obamacare last year, 48 million claims were denied, which is it's almost 20% of claims. So you have about a 1 out of 5 chance of getting your claim denied. And that's fine if it's a, $150 primary care visit. But if it's a $100,000, heart ablation or something like that, that puts people in financial difficulties. And in fact, what we're finding is, 150,000 to 200,000, something like that, depending upon the year, those families go bankrupt. So almost 200,000 families go bankrupt every year because, their claim is getting denied, or, these deductibles are so high that they're not able to pay for them. So, there's just an incentive issue here that is perverse, and that's ultimately what's leading to our problem on the health insurance side. The sellers of healthcare are hospitals, and those hospitals are gobbling up primary care docs and cardiologists and all kinds of things, and they're creating these big monopolies within cities. So I live in Austin, Texas. Austin has 2 primary hospital systems. And so when United Healthcare comes in and says, hey, I want to, reduce your compensation for XYZ claim or XYZ procedure, the 2 hospital systems are like, no, we're not doing that. So it's basically monopolies or oligopolies that are trying to negotiate with monopolies or duopolies. And in those cases, like, prices will just go up. That's just, pretty basic economics. So, it's not that complex. It's, the buyers of healthcare, which are the health plans, have no incentive to really reduce costs. The sellers of healthcare, the hospital systems, have no incentive to reduce cost, and therefore costs go up.
So this is why. So I actually do sympathize with like the Bernie Sanders supporters who say like this system is totally broken. We should nationalize it. So you've obviously created an alternative to that. So why is nationalizing it, I guess, not the best idea?
Yeah, so I mean, I think we can look north, to Canada, which is a nationalized system. And in fact, in Canada, it is illegal for you to pay cash for services if you want a doctor. So you are stuck in the queue. And I saw a stat the other day that it was something like 40 weeks to see a orthopedic surgeon in Canada in 2021. So let's just say you tear your ACL, you have to wait, almost 9 months to get your ACL repaired, and at that point, things have gone haywire within your knee, right? Like there's some irreparable damage there, and so there's a cost and a quality issue here that we have to take a look at. Everybody says, oh, well, it costs way less to do it in Canada. Well, you're paying taxes into that. Their tax rate is significantly higher than ours, and the quality of service is significantly lower, right? And so I don't think people want to nationalize service if the quality of their healthcare goes down. Everybody rips on the American system, but look, all the Saudi kings, queens, royal family or whatever, where do they go to get their healthcare? They come to the United States, and in fact, hospitals in New York City have floors dedicated to Middle Eastern, the royal family. So when they come in, they just pay cash and they want to come and get their healthcare from the United States. So we've got the best healthcare in the world. But we also pay the highest price because of our screwed up insurance system.
Right. We have the best, but also the worst. So if you're poor in America,
Yes.
like you literally can't afford some of these basic procedures, or insulin is always a huge topic. So like we do have the best care in the world, but also that's only for the rich, right? It's only for the people that do have extraordinary amounts of money. So if you're poor in America, it's actually tough, right?
Yeah, it is in some services, and some it's not. So on Medicaid, right? So that whenever the government steps in and goes to Medicaid or Medicare, they drop prices significantly, and they don't pay the doctors worth crap. And so the doctors say, look, I have enough business from either cash pay or commercial places, and so I'm not going to accept Medicaid and Medicare, which in essence creates a situation in which the best doctors are only providing services to the people who are on commercial plans or who can pay in cash. All the doctors, not across the board, but in many cases, the doctors who can't get enough business from commercial or cash will provide Medicaid services. And so the folks on Medicaid tend to get the doctors that others don't really want to go to. With that said, hospital systems, things like that, like if you go to the hospital, you are going to get high quality care, and that's why all these folks on Medicaid go directly to the ER when they have small issues, because they know they're going to be treated by really good docs at these hospitals. They know that the docs in their local areas kind of suck, and so they treat the ER like their primary care physician, and that then puts pressure on these hospitals because they're like, you have a sore throat, dude. Like you shouldn't be in the ER, right? And so there's just, whenever the government gets involved in something, it really screws up the economics of the entire system. And so we're really trying to change that, and I think we've got a pretty good start on it.
So can you talk about why you started Crowdhealth in the first place? Because that's a huge endeavor to go up against some of the biggest behemoth billion-dollar insurance companies in the world, go up against the U.S. government, essentially, right? They would love to outlaw private anything, essentially. Yeah. So what was the inspiration, and I guess how did you do it?
Yeah, so let me give you a little bit of background, and I will say this, hopefully humbly, but I sold a company back in 2014. We took it from a dozen employees to several hundred employees over a 6-year period. It went great, went really well. So I was in a situation where I moved down to Austin. I love fishing and tacos and all those kinds of things. So I was going to enjoy that for a little bit. Didn't have health insurance because I was no longer with my company, and so I went on healthcare.gov. I thought it was my only option, and got this health plan that was $1,200 a month. And I joke, it worked until I had to use it. My little one, who was 1 at the time, was having recurring ear infections, so we went to the ear, nose, and throat doc, who said, oh, she's got a perforated eardrum. She's got a hole in her eardrum. And so she needs to get tubes in her ears. So we went to the local hospital, got tubes in her ears. It was a 15-minute procedure, got the bill, and it was $8,000 for 15 minutes. I was just like, holy crap. Like, this is crazy. But this is what health insurance is for. Like, this is the whole point of having health insurance. Well, unfortunately, that was one of the 48 million or whatever claims that was rejected because the health plan said it was medically unnecessary. And so I was like, hold on a second. My ear, nose, and throat said she's got literally has a hole in her eardrum, and you're telling me it's medically, unnecessary. And so I had to stroke an $8,000 check to the local hospital, and I had been fortunate, and I could do that. But I kind of got to this place of saying, like, I can do that, but 90% of Americans don't have $80,000, or maybe more. It may be more like 98 or 99% of Americans don't have $8,000 sitting in the bank account for something that is just run of the mill, not like dramatic. It's just, my daughter's got, recurring ear infections. Like, it's not that big of a deal. Many Americans deal with this. And so I was like, something's got to change. And so I called the health insurance plan. And I said, I quit. If you're not going to pay my bills, I'm not paying your bills. And so my family has been uninsured for, I think, more than 3 years now, 3.5 years. And as we walk through that, we said, okay, what tools do we need as people who are uninsured to navigate this system effectively? And, ultimately those tools that we created turned into a company, because I was like, other people, need this. Like, if we're dealing with this, then other people need this. And so we started Crowdhealth. But to your point, like, we're going up against the largest companies on the planet. I mean, United Healthcare, I think, is the 6th or 7th largest company. CVS Aetna is the 7th or 8th largest company, something like that. And so they have, hundreds of billions of dollars to squash little Crowdhealth. But I'm like, this is not a financial thing for me. This is a missional thing. And I truly believe that it's a tragedy that we have hundreds of thousands of families every year going bankrupt, and somebody needs to change it. Right. So we're going to take a stab at it. And, we've had regulatory intervention. We've addressed those successfully. And we're just going to keep, plodding on, just like, the Airbnbs of the world were going up against the big hotels, and the Teslas were going up against the big, motor companies, and all these companies, right? That the Ubers are going up against the big, taxi companies and things like that. So, all of these companies that are changing the way that we do life go up against really huge incumbents, right? And that's what we're going to try to do. And if we can just keep providing awesome service to our customers, I think ultimately, people will opt out of health insurance and be like, man, I don't want to do this anymore. I don't want to be a slave to the health insurance business. I want to try something different. And, as you said before we started, Crowdhealth is you've liked it. I think everybody else, really likes it. And you can count on, almost two hands, like the number of families that leave Crowdhealth every month. Like, it's really tiny, and we have thousands and thousands of people on Crowdhealth. And so, like, if you join Crowdhealth, you stay on Crowdhealth because people really love the service and love the freedom.
Yeah, it's been great. So I joined, I think it was October of 2021. I needed I needed to change my health insurance for personal reasons. And I was like, why am I going to pay $1,500 a month for this plan? Really? And I was like, no, this Crowdhealth. I think it was like $299 a month or something at the time, whatever I signed up for. And literally every time, sorry, allergy season. I had to go to doctor twice. I'm a young, healthy dude, 37. I don't have that many issues, but I had to go to the doctor twice. I just emailed the Crowdhealth. They sent me, here's the local providers for you. Here's what it's going to cost in cash. Is that okay? I was like, yeah, $65 when normally the insurance would have been billed 150 or something. So like, it's been perfect for everything I need. It's great. So I guess the question is, who is, I have a group of freelancers that I coach. And freelancers don't have traditional employee health insurance, which is what most people in the world right now are opted into automatically. So I guess, who is Crowdhealth for? And if you're an employee, does it make sense to just keep your current plan, or is there a reason to go Crowdhealth on top of that, or besides that?
Yeah. So, interestingly, the folks that have joined, the breakdown is about 60% of people have come to us from being uninsured. So they're comfortable with being uninsured. They just want, tools. 20% of our members are coming to us from corporate health plans. They've opted out of their corporate health plan. They're like, man, like, the deductibles are really, really high. My corporation is still taking money out of my paycheck that's really high. I've got a family, and it's really expensive to put my family on my corporate plan, and so I want to join Crowdhealth for that reason. And then 20% are if you're at a health share, if you're in Cobra, or if you're in one of these crappy short-term health plans, they come over to us from those as well. And so that's where they're being sourced from. But the people who are joining us are generally folks who skewed male, so 60% male, 40% female, 60% single, 40% families. But it's a lot of people who their health insurance through their employer is really, really high, or they're a freelancer, a gig economy worker who they could go to healthcare.gov and they see a bunch of these silver, gold, bronze, crappy plans that I have to pay a lot for and not get much for. That I went on healthcare.gov, and for my family this year, I might be a little bit off, but I think it was $1,500 a month, and it was a $12,000. I think it was $12,000 deductible, which basically means that I have to pay $30,000 before the health plan pays a dime, right? Mm-hmm. And I'm like, why am I doing that? Why would I do that? That just doesn't make sense to me. My family under Crowdhealth is $695 a month, so I'm 8,000, a little over 8,000 in, and then I pay the first $500 at any health event. Anybody, and the reason we do that is like anybody should have, or most people have $500 in their bank. So if something big were to happen, that they would be okay. Like our mission is not have 0 people on Crowdhealth go bankrupt, whereas hundreds of thousands of people are going bankrupt with general insurance. And so we just think it's a great option for freelancers, gig economy workers, small business owners who the traditional health insurance is just. It's just, one, it's crap, and two, it's really, really expensive. So, for a single person, it's $175 a month. And, that's really inexpensive when you compare it to some of the alternatives. And I think we give you way better service too. So, that was a little long-winded way of saying, it's for lots of folks for lots of different reasons, but ultimately they look at health insurance and say, this is just not what I want. It does not give me the freedom that I'm looking for.
So can you get into kind of the nuts and bolts? So it's not insurance. Crowdhealth it's different than insurance.
Not insurance.
How does it work actually?
Yeah, it's not insurance. And I think the funny thing here is we can't guarantee that your bill is going to get paid, or else we are considered a guarantee, a surety. And so therefore we are, put in the health insurance world by regulators, and the whole thing crumbles. The funny thing about that is that health insurance plans do guarantee that they'll pay your claims. However, like I said, with healthcare.gov, 48 million claims were rejected last year. I'm doing some crowdfunding this morning. I think I'm on bill 3,800 or 3,900 or something like that. And every bill that has been submitted to the community has been paid. And so let me walk through the mechanics of how that happens. So every month, let's just assume you're single here for a minute. Every month it's $175. You put $175 into an account that we create for you when you join. And then we take $40 of that for a subscription fee. That's how we're paid. That's the only way we're paid. It's just a subscription fee. It's very transparent. And therefore, we are fighting for you to get your bills paid as opposed to fighting against you to get your bills paid, right? That's a key indicator. So $175 goes in, we take 40, 135 is left in that account. Let's just say that Henry, breaks his arm and it's $5,000. So Henry would pay the first 500, and then we would crowdfund the remaining 4,500 from the community of people. So we would go and ask, let's just say 100 people for $45. So we, if the person says yes, then $45 goes from their account to Henry's account. And, and as soon as we have $4,500 in that account, then Henry has enough to pay for his broken arm. So it's super, super simple, super easy to do that. Think about, I hate saying this with the whole trucker debacle for, a couple years ago or whatever that was, but it's kind of like a GoFundMe, but for almost all of your healthcare expenses. And we have a dedicated group of people who said yes to helping other people in the community. So all the bills have gotten paid thus far. 98% of the people we ask to help other people say yes. We even have people who say, we had a woman in Tennessee who got her 4 fingers cut off in a boating accident. And so we had members, when we told the story to our members, that would you help her? They were like, yes. And can I give more than what you've asked? Like, whenever have you told your, health insurance plan, I want to give you more this month, to help other
Right.
people. And so it's, really bringing humanity back to healthcare, which I think is a special, cool thing. So that's how the mechanics of this work. And so it's super easy to use.
Yeah, it's great. So I think it's like 1 or 2 a month, maybe at tops of requests. And it's usually like $40 for a pregnancy or, $35 for an emergency room visit or something.
Yeah.
And I've never turned it down. So I have something like, it's kind of like a health savings account, and that there's an amount that I have, but at the same time, the community has your back. So
Yeah.
I don't know. It seems like everybody fulfills these requests. It's
And when you leave, we don't want you to leave, but if you were to leave, you actually get the money in that account. It's your money, so you get it back. And so that's the cool thing. Like, if you send your money into a health insurance plan, it disappears into the black hole of insurance world, right? And this, it's like, you're actually putting money into an account that's yours. It's your money. And so if you were to leave, you get to take that money with you. And so it's, we say it's $175 a month, but in reality, it's, say half of that, because most of that money is still sitting in that account. So of the money that you've put into the account, we've only asked for 43% of it. So which means that 57% is still left in that account. And we ask people about once a month. It's been about once a month for the last 2 or 3 months. And every time we ask you, we'll give you an update on what your balance is in that account. So it's different than health insurance. People should not think of this like health insurance. It's completely different.
Yeah. So I just released this course for freelancers, and, I had almost 90 people join for my small little list. That was pretty good. But one of the big concerns from people that didn't join was like, well, I need family health insurance. I need to, I'm like, I can't lose these benefits. So I guess, what is the reality of that statement? Like, people are worried they have kids with like pre-existing conditions or mental health issues. Who is Crowdhealth not for, I guess, would be the question. Like, is there a certain demographic that like, no, you this is not right for you?
Yeah. So there's only 3 reasons why we would not allow you to join the community. One is you're over 260 pounds. And nothing against those folks, but if you can get down to 260, we'd love to have you in the community. If you're a smoker, then you can't. And that means, consistently every day. That's not like have a cigar once in a while, right? Like that's fine. But if you're smoking every single day, that's a problem. And the third is if you're currently pregnant. So if you're currently pregnant, then you can't join. So we just don't think it's right for people to join and then try to drop, expenses. It's like, oh, my baby's due next month. Let me drop that $13,000 expense on other people. We just don't think that's, the right thing to do. So, and then in terms of pre-existing conditions, we've got tons of people in our group that have pre-existing conditions. And the only thing we ask is saying, hey, if you want to join Crowdhealth, then you have to pay for your own pre-existing conditions for 2 years. And then after that, then you can share them with the community. Again, it's like we have to have some mutual responsibility here. And so we've had people who have been with us for 2 years and had we just crowdfunded one yesterday for a woman who had breast cancer 8 years ago. And it's something is now popping up. And she's a part of Crowdhealth, but given it was more than 5 years ago, we're currently crowdfunding for that woman who has some complications with her breast cancer that happened 8 years ago, but she's been with us for a while. So we're trying to support those folks. We had a guy join about a month ago, maybe it's 2 months ago now, who has type 1 diabetes. And he's like, the crazy thing is that my type 1 diabetes is going to cost me a lot less if I were on Crowdhealth than if I were on, any kind of other health plan. Because these other health plans are $7,000-$8,000 deductible. So he's got to pay the first $7,000 or $8,000 of that. Right. And he actually can get his insulin and all that kind of stuff significantly less if he's uninsured And so he's getting his insulin for, I think like it's a third of what the health insurance plan pays for, because he's uninsured and he's paying in cash. And so he's like, the math just doesn't work for me to go with health insurance, even though I have type 1 diabetes. So it's a crazy, crazy scenario. And before we tag off here, like that's an important point. If somebody can pay in cash, the insurance industry is so screwed up that we are getting on average about 60% better pricing than health plans for bills greater than $1,000. So these doctors are basically saying, I hate health insurance. So much so that I will give you a significant discount if you will pay me cash at the point of care, because then they don't have to bill health insurance. They don't have to get pre-auths. They don't have to wait for their money, all of these things. And these doctors, the only people that love us probably more than our members are the doctors, because they're like, man, I really want cash and not have to deal with the health insurance, plan. If any of your listeners who are, probably awesome at what they do, if they had a little person sitting on their shoulder telling them what to do and how to do it, they would drive them nuts. And that's in essence what the doctors have with insurance plans. That insurance plans are sitting here on their shoulder being like, you can't do this. You have to do this. You can only use this. You can only use that. And you're like, dude, buzz off. Let me do what I need to with my patients to make them better, as opposed to a health insurance plan getting in between.
Right. Stop messing with the market. Actually let the people that are professionals allegedly do their job.
Exactly.
Man. So for anybody that wants to, just before we start doing a little private Q&A, where can people find out more about Crowdhealth and getting on the service and
Sure.
saving a bunch of money on their healthcare costs?
Yeah, I mean, if you're interested in this topic, you should follow us on Twitter. It's Join Crowdhealth on Twitter. We've got lots of thoughts on what's going on in the industry and why your health insurance is so screwed up, and some really we get a little sassy about it too, so it's kind of fun. If you want to join up, you can go to joincrowdhealth.com. And like I said, it's $175 if you're an individual. It's $695 if you are a family of 4 or more. So we think it's very, very reasonable. And like I said, the majority of that sits in your account. So, it's actually, a fraction of that really. So joincrowdhealth.com is the best place to go. There's a link there if you want to talk to somebody and you have other questions that I haven't answered on our podcast. We'll set up a 15-minute call with you just to answer any of your questions. So yeah, joincrowdhealth.com.
All right. And you guys know I've been talking about Crowdhealth now for a year or so on the podcast, on and off. So I fully endorse it. I think it's a great service. And Andy, thank you so much.
Yeah, thanks for having me. Appreciate it.